Just want to thank everyone for joining us this afternoon, and today we'll be giving you some information and update of what's been going on with the marketplace and enrollment in Ohio. We're sure that you've got some burning questions already, so feel free to submit them at any time throughout the webinar, and we'll make sure to leave plenty of time at the end of the webinar to answer them. We're really excited about answering your questions. So to start things off, we're going to go over a few technical details. Here you'll see a screenshot of what the GoToWebinar toolbar looks like. First, you'll see the little red arrow that expands and minimizes the toolbar. So if you don't see the toolbar and you see the little red arrow, click that and it will expand the toolbar so you can control your audio settings and ask questions. Below that, you'll see a green button that mutes and unmutes your mic on your computer. If you'd like to ask a question at the end of the webinar, you will be using your mic. Make sure that you have yourself unmuted. The button with the little hand allows you to raise your hand, and that will let me know that you have a question. And if you have your audio settings enabled, I will be able to unmute you at that point, and you'll be able to ask the question live on the webinar. Also, under those buttons, you'll see the audio settings. You can select telephone if you'd like to listen and interact with us over the phone. Once you've selected the telephone option, it will provide you with the phone number, access code, and audio PIN, which will allow you to ask live questions over the phone at the end of the webinar. If you're having any trouble with sound, using the telephone is usually the best connection. Also, you have the option to select a mic and speakers, which allows you to listen to this webinar over the computer. If you'd like to ask questions live via the chat box, there's no need to have a mic. But if you'd like to answer questions live on this webinar, you'll either need to have your mic or you'll have to call on via your phone. And really last and most important thing is the questions box. And you can enter any questions or comments you have during the webinar in that box. Submit your questions as they come to you throughout the webinar. I'll keep track of them all and make sure we can answer as many as possible at the end. So before I turn it over to Kathy and Kathleen, just a few general housekeeping. Submit questions at any point during the webinar. We will have an opportunity to ask questions live at the end. Either if you want to do that live, you must have your telephone or mic enabled. Right now we do have a copy of the PowerPoint available. It's available at UHCANOhio.org, not OhioConsumersForHealth.org. And this webinar is being recorded, and we'll post it up on our website tomorrow. And also just a reminder that this is a closed call, and any comments made are considered off the record. So today, you'll be hearing from Cathy Levine, UHCAN Ohio's Executive Director and Co-Chair of Ohio Consumers for Health Coverage.
Oh, hi, everybody.
And you will also be hearing from Kathleen Gmeiner, Project Director of Ohio Consumers for Health Coverage.
Hi, everyone.
And I'm Melissa Chenault, and I'm the Communications Manager here at UHCAN Ohio, and I'll be moderating and fielding questions at the end. So to start things off, we'll just give you a quick idea of who we are and what we're currently working on. Kathy?
For those of you who don't know, UHCAN Ohio is a statewide, nonpartisan, nonprofit organization working to achieve quality, affordable health care for all Ohioans.
Okay, thanks, Kathy. And Kathleen, a little bit about OCHC.
Yeah, Ohio Consumers for Health Coverage is a broad-based coalition building a consumer voice, working to achieve quality, affordable health care for all Ohioans.
Great, thanks. And if you have any questions about our organization, feel free to visit our website. So just a quick overview of what we'll be covering today in our webinar. We'll give you some key facts about what you should know about the marketplace and Medicaid, give you an update on what's going on with enrollment in Ohio, tell you about what those assisting in the enrollment process are learning that you need to know, where to go for help enrolling in the marketplace, and what you can do to help others get enrolled. We're going to kick things off with Cathy Levine.
Hi, everyone. So I'm going to start by going through some recent information that's come out and important deadlines, starting out with enrollment in Medicaid. On October 1st, Ohio launched a new eligibility system to make it a lot easier to enroll in Medicaid in Ohio. And you've got the website there. It's benefitsohio.org. On December 9th, the website began taking Medicaid applications online for people eligible for the expansion and people who were already eligible for Medicaid. They received 1,165 enrollees the first day. One of our staffers here enrolled somebody on the website today and said it was really easy to use. It's a simplified self-service website that makes it easier for Ohioans to learn about what's available and to sign up. What's good about it is that you don't need to submit a lot of paper verifications. They rely primarily on electronic data, and only if they can't verify your basic facts and income electronically will they ask people for additional information. Anybody who doesn't qualify for Medicaid will be directed to the federal health insurance marketplace. Next. Oh, one other thing about the website. It was designed to enroll people in a host of benefits, but right now it's only taking Medicaid applications. The eligibility workers in the county are still are actually working on two different systems. You can use ohiobenefits.org .gov only to sign up for Medicaid. If you want food stamps or other assistance, it will go through the other eligibility system. The complete build of the whole new benefits website won't happen for another 2 years. So now I'd like to go over important deadlines. October 1st is the day that open enrollment started. The deadline for applying for enrolling in order to get insurance on January 1 has been changed to December 23rd. So if you fill out your application and are found eligible by December 23rd, and you can get insurance on January 1st of 2014. You must check with the individual insurance company as to the actual deadline for paying the first month's premium. Know whether you have to pay the premium by December 23rd or whether the insurance company will give you a later deadline. January 1st is the first date that health coverage can begin for those who enroll and pay their premium on the first day. That's very exciting. And March 31st of 2014 is the date the open enrollment period ends. Keep in mind that people can only, if people want health coverage on the marketplace, you can only enroll during the open enrollment period unless you have some change in circumstances. So it's very important that people who want coverage on the marketplace must enroll by March 31st of 2014. Otherwise, they wait till the end of 2014. So who's eligible? The marketplace eligibility requires consumers to live in its service area, which basically means all of Ohio for our purposes, be lawfully present in the U.S. for the entire period for which enrollment is sought, and not be incarcerated unless you're incarcerated pending charges. The marketplace will only sell qualified health plans, and a qualified health plan, which is defined under the Affordable Care Act, must cover 10 essential health benefits. That's to ensure that anybody who gets coverage through the marketplace has all of these major categories of benefits. You can look at what they are, and I defy anybody to find something that isn't included in the essential health benefits. So all these categories will be covered, but the devil is in the details, and Kathleen will talk more about that later. Next. So things to think about when you're choosing a plan. As I said, each plan will have the 10 essential benefits, but how much will they cover of each of these benefits? The first thing that you're going to concern yourself with is how affordable is the premium, and then what about the out-of-pocket costs? Because if the premium may be very low, but if you have to pay a lot of out-of-pocket costs to get the coverage you need, that plan may not be as affordable as it looks. So you've got to consider the affordability of all your costs. The provider network. Plans are keeping prices down by providing pretty narrow networks. So you're going to want to, if you have providers that you want to keep seeing, you're going to need to look at the provider network for the plan you're interested in to see that your providers are there. Prescription drug formulary, we'll talk more about that later, but if you're on a particular prescription drug, you're going to want to make sure your plan has it as a preferred drug. If you can find it as a preferred drug, you'll see the plans have different tiers. You don't want to enroll in a plan and find out you have to pay a lot to get the drug you've been taking. And then limits on visits and other details that are important to your particular health needs. The other thing is, if you or somebody you're helping is likely to be going back and forth between Medicaid eligibility and the marketplace because your income goes back and forth above 138% and below 138% of poverty, you may want to look at an insurance company that is both in the marketplace and Medicaid. There are several Medicaid managed care plans serving the Medicaid population in Ohio that are also offering on the exchange. That way you can stay in the plan when your income changes. Your benefits will change. So affordability, or what we like to call the marketplace Olympics. There are 4 levels of coverage offered in the plan. What each level of coverage offers is differs. The cheapest plan is the bronze plan, and it's cheapest because it pays an average of 60% of your health care costs, and the enrollee is going to pay 40%. Now, this doesn't mean, this is what's known in insurance language as actuarial value. It's an estimate of what everybody enrolled in that plan on average will pay. It doesn't necessarily mean that you'll pay 40%. But that's the value of the plan. It assumes that the average person would pay 40% of the cost. So it's cheap, but it's going to cover less. Silver plan costs a little more, covers more, and enrollee pays less. And it goes down to platinum. Kathleen will correct me if I'm wrong, but I do not think that there are any platinum plans even available in Franklin County. Next. Yeah. Next. So we'll be talking more about the levels of coverage when it comes to looking at what kinds of subsidies you get. That the levels of coverage is going to be important to notice. So affordability. The way that, the Affordable Care Act requires people to have coverage, but only if you have access to affordable coverage. And the method for making insurance affordable to people is the advanced premium tax credit. And there's a reason why it's called an advanced premium tax credit. And I'll explain that in a minute, but the premium tax credit is based on 2 things. One, the income of the person or family enrolling. So you're going to get a tax credit based on what your income is. And it's also tied to the cost of the second lowest silver plan. And if you've never heard this before, I've probably lost you, but I promise you by the time we're done, you'll understand this. So that's how so what will you pay when you go on the exchange? The way that that what you will pay is determined is by first looking at your income on this chart. You look at your annual household income, and depending on your income range, you will pay. If your income is pretty low, you're going to be expected to pay 3 to 4% of your total household income for your health insurance premium. Now, if your income is close to 400% of the federal poverty level, you're going to pay more of your income, a larger percentage, 9.5%. So this is an effort to make the tax subsidies fair depending on people's income. Next. How is the subsidy computed? Okay. First, you look at now keep in mind that the cost of health coverage in the new marketplace will vary by your age and where you live and whether you smoke. So you would in calculating your subsidy, the marketplace will look at your age and where you live and look at the monthly premium of the second lowest silver level plan. Remember, there's bronze, silver, gold, and theoretically platinum. Silver is the level that provides 70% of coverage. You look at all the plans offered on the silver level in my county on the website, and the second cheapest plan, they take that premium and then they figure out my share based on the chart. What's my household income? What percentage of my income am I expected to pay? That percentage of annual income is what I'm supposed to pay, then divide it by 12 because we're figuring out my monthly premium, and you figure out what I'm allowed to pay. So if I were a 45-year-old single person, the monthly premium in Franklin County for the second lowest plan is $285 a month. That's even without a subsidy. Based on if my income was $17,235 a year, the chart says that I should pay 4% of my income and then divide that by 12. You get $57 a month. That is the share I'm expected to pay. That means that my advance premium tax credit is going to be $228. Now, I can take that tax credit and buy the second lowest silver plan, which costs $285, and my premium will be I will pay $57 a month. However, if I decide I want a more expensive silver plan or a gold plan, I can take my advance premium tax credit and apply it to the monthly premium, but my share, instead of being $57 a month, will be larger. So this is what I will pay only if I buy the second lowest silver plan. Now, if I decide to go for a cheaper plan in the bronze plan and I apply my tax credit, I may end up, if the plan is cheaper, I'll pay less than $57 a month, but I'm going to get less coverage. Next. So how can I use the advance premium tax credit? You can apply the tax credit to any plan you want, but the tax credit, as I just said, is based on the price of the second cheapest silver plan. And the tax credit is going to be the same no matter how expensive the other plans are, which means that if that second lowest silver plan doesn't meet my needs, that's the only tax credit I'm going to get, and I will be paying more. I will have to pay more out of pocket for a different plan. Now, if your income is at or below 250% of the federal poverty level, and you want further assistance with the out-of-pocket costs, you must purchase a plan on the silver level. The only way to get additional help with out-of-pocket expenses is to buy a plan on the silver level. It doesn't have to be the second lowest, but it's got to be a silver level plan. Now, what you have here is, in this chart, is an example of the prices that are available for a 45-year-old person in Region 9, where you could find a gold plan for $337, a silver plan for $269, and the bronze plan, and, you know, take my tax credit of $228, you can see how much I'll be paying with each of these plans. Next. So people hear tax credit and they think, well, does that mean I'm going to pay the whole premium up front? I can't afford to pay the whole premium up front and then get a big tax refund at tax time. That's why this is called an advance premium tax credit, because you have a choice. You can choose to get the advance premium tax credit, which will reduce the premium you pay each month. And the advance payments, your tax payments, are paid directly to your insurance company. You pay your share, and the government pays the rest to the insurance company. But the only pitfall in doing this is that the amount of your tax credit is based on your projected household income. And if your household income is greater than you projected, you will have to pay back money at tax time. And to protect from that happening, any time there's a change in household income or a change in circumstances, such as a new family member or somebody moves out or your income goes up or down, you need to report it to the marketplace to make sure that the tax credit you're getting is still accurate and you don't end up having to pay additional taxes when filing. On the other hand, if you're paying more than you were supposed to, you'll get money back at tax time. So all of this talk about the advanced premium tax credit is only about making your premium cheaper. And when we look at the plans, you'll see there's a lot of cost sharing. There's deductibles, there's co-pays, which can make health care unaffordable to people even who have insurance. Therefore, cost-sharing help is eligible for people, and by cost-sharing we mean out-of-pocket costs. Cost-sharing help is available to people with incomes at or below 250% of the federal poverty level, which is $58,875 a year for a family of 4 in 2013. And again, as I said earlier, they must be receiving a premium tax credit through the exchange, and you have to enroll in a marketplace silver level qualified health plan. So the cost-sharing help is not available to somebody who's getting insurance outside of the exchange. You have to be enrolled in the exchange, getting a premium tax credit, and actually enrolled in a silver level plan. Next. So that's an overview of affordability and cost sharing. So if you have questions, submit them now, and we'll try to answer them before we I just want to go over catastrophic plans. In order to attract young people who feel that they are invincible and will never need health care that amounts to much, they have the option. If you're under 30, you can buy what is called a catastrophic plan. It's called that because it doesn't cover a whole lot besides big bills. So if you have a catastrophe like appendicitis, broken bones, something worse, then the insurance is going to kick in. So if you're under 30, you can buy a catastrophic plan. But there are also people who are going to go to the exchange and they're not going to be able to afford what's offered to them, and they're going to apply for a hardship waiver so that they don't have to pay a penalty because they don't have insurance. So if I absolutely can't afford to buy any of my choices at the marketplace, I can apply for a hardship waiver so that I don't get a penalty, but the problem is I won't have insurance. And in that event, I can buy catastrophic coverage. And so what is catastrophic, regardless of my age? So what is catastrophic coverage? It's plans with very high deductibles and lower premiums, but it does include coverage for 3 primary care visits and preventative services with no out-of-pocket costs. So it provides some, which is good, that everybody should get that. And it provides some protection to consumers, but the high deductibles, if you really need to use that insurance, you're going to have some pretty high out-of-pocket costs. Next, so that does it for me. I think it's Kathleen's turn.
Okay. Hi, everybody. So the next part that I want to talk about is the benefits and the deductible. The essential benefits that are in the plan are very important, but when it comes right down to it, one of the most important factors for people when they're choosing a plan is looking at what the copay is for a physician visit and what the copay is for a specialist visit. And then just as important, are the physician and specialist visits subject to the deductible? And what that means is that sometimes people have a plan. It may have like a $3,000 deductible, which is generally the amount that the individual has to pay out on their medical claims until the plan kicks in. But in many plans, certain things are not subject to the deductible. And so that means that you could go to the doctor for routine care, you could see a specialist, and you would simply have a copay for that and not have to wait until you've spent $3,000 before you can even get help from the insurance company paying for your doctor visit. But some plans actually do require that you first exhaust your deductible before they start paying anything on physician or specialist visits. So it's really important when you're looking at the plan, and I think there's a screenshot here of healthcare.gov coming up in a little while, and I can show you where you look for that. But it's really important to ascertain that information. Next slide. So as Cathy mentioned earlier, the qualified health plans are using small networks, or maybe I should say smaller networks, to keep the cost down. Why is that? Well, if a plan can say to a group of providers that, we're going to give you all of our business, then theoretically, at least, the providers are going to be willing to do a deeper discount. So that's the theory behind this. So when you are on healthcare.gov, either yourself looking at your own situation or perhaps trying to help someone else enroll, you want to make sure that you click the link when you are viewing the plans that takes you to the plan network. And that's how you determine what hospitals the plan is using and what doctors are in the network. And if you're not sure about whether your doctor is in the network, for instance, you go to the plan network and for some reason it just isn't clear, maybe your doctor's part of a group and you don't see the name that you're most familiar with there, then you can call the doctor or call the plan or do both. One of the problems is right now is that in some cases the plans are still concluding their contractual relationships with the providers, and so it's possible that some doctors may not even be sure which plans they're in. So that's why I like to tell people to check both with the doctor and with the plan. Next slide. The other thing that's really important is the drug formulary. And when you are viewing the plans, there's also a link that will take you to the plan's drug formulary. A health plan providing essential health benefits must have procedures in place that allow an enrollee to request and gain access to clinically appropriate drugs not covered by the health plan. But what I think it's important to realize is that provision is in the law. The insurance companies are going to be very reluctant to authorize drugs that were not in their network because they are able to get discounts when a drug is in their network, and that helps them financially. So I would never choose a plan that didn't have the drug that I needed, thinking that I will somehow ask for an exception. When this is particularly an important provision, however, is when you choose a plan at one point in time, with one set of medical conditions, and later in the year something develops that wasn't even an issue at the time you chose the plan. And that would be a reason that you would perhaps need to seek an exception that would allow you to get a clinically appropriate drug. Next slide.
Kathleen, can you explain what a formulary is?
Oh, thank you. A formulary really is kind of like a list. So it's just the list of drugs that are provided, and they come in classes and categories. Originally, the Affordable Care Act was going to, I think it specified, maybe not the act itself, but the regulations were specifying at least one drug in each category and class. But it actually was changed so that it's a little more relaxed standard now, and it's they have to have up to the number of drugs in a particular class or category that were in what's called the benchmark plan in the state. And in Ohio, that's a small business anthem plan that was used as the standard for figuring out what the benefits are. So the formulary is a list.
But Kathleen, doesn't it have tiers in it, though?
Well, drugs are in tiers, but the drugs, yes, the drugs are in a list by category and class, and then usually, it depends on how it's set up, you will be able to look perhaps to the right of that list, and it'll list it as being either Tier 1 or Tier 2, or maybe they'll call it preferred or non-preferred. Usually, as the tier numbers go up, they get more expensive for the consumer, but different plans use different terminology. Next slide. So one of the things that has just been developed that is really exciting is that you can go on to healthcare.gov and look at plans before going through it to set up an account. And so if you want to enroll, you would have to go on to healthcare.gov, create an account, then they determine your eligibility for subsidy and eligibility in general to be in shopping in the marketplace. And then you can go on to view the plans. But some people aren't really ready to enroll. They just want to look at the plan so they can think about it. And up until last week, if you did that, you could see some minimal information like the general premium of the plan, but that's about all you could see. Now you can actually see almost everything that you need, even before you get into the enrollment. So you go to healthcare.gov and you see three little circles, and you click on the one that says See Plans Before I Apply. And it will ask you a number of questions about your location, your age, whether you're looking for an individual plan or a family plan, or whether you're shopping as a business person for your employees. Then the plans will appear, and you can sort them by the metal levels, like bronze, silver, gold, or you can sort them by premium amount. And you can see the monthly premium, deductible, out-of-pocket maximum, co-payment, and co-insurance information right there on the screen. And then there's a place where it says Details, and by clicking Details, you can see the provider network, the drug formulary, and the summary of plan benefits. Next slide. So this is basically what it looks like, and I know the print is small here, but what we're seeing is the way it's going to appear on your screen. And so you see a monthly premium of $449 a month. The deductible is $7,000 per year for a family or $3,500 for the individual. The out-of-pocket, that means the maximum out-of-pocket that the family can be required to pay is $9,700 for the year, or per individual it would be $4,850. Now when you look over to the right is where you see copayments, coinsurance. Primary doctor, $25, specialist doctor, $50, generic prescriptions, $15, and an emergency room visit, $250. So to know, like you want to know a little bit more about this, so you click on details, which we can't do here because we're not actually online. But when you click that details button above, that's when you will get the link to take you to the provider network and to the drug formulary and to the summary of plan benefits. And that summary is very important. It's prescribed by the Affordable Care Act. It went through lots and lots of regulatory proceedings with consumers weighing in on you know, what needed to be in it and how language needed to be simplified. And it's probably still not simple enough, but it's a lot better than most of the insurancees that people, you know, have seen in the past. Now I want to point, if you can just go back to the back to that, Alyssa, thank you. If you look at that Market Bronze plan right below, you know, the second plan from the top, now look to the right where it says copayments, coinsurance, and it says primary doctor, no charge after deductible. What that means is that you've got this deductible for each individual, $6,000, and so you're not going to even get your doctor visit paid for until you've met that deductible. You're not going to get the specialist visit paid for until you meet the deductible. So that is a very important thing to look at because it really does have a lot of, I mean, that's going to be a critical fact for most people when they're choosing a plan. Okay, go ahead to the next slide. Then if you want to find your likely subsidy, so this is assuming you're not going right now through healthcare.gov, you're just trying to get a general idea of what, you know, the ballpark figure is going to be. You can go to the Kaiser Family Foundation website and either the link that's there on the screen or just kff.org and then scroll down to calculator. You enter the requested information. It will tell you what % of premium you are expected to pay. And then it gives you kind of an average plan and so a general idea of what you'll pay for someone of your age and in your region. But frankly, I think it's a little bit more accurate if you then go back and look at the plans and find the second lowest silver plan in that list that we were just looking at the screenshot of. And then you subtract what you must pay, just like Cathy showed a little earlier on the other slide, and the remainder is your subsidy. Next slide. Now, there's something that's happening right now called direct enrollment. Ohio, Texas, and Florida were chosen to be 3 demonstration states where residents could directly enroll in health plans and still get the benefit of the subsidies. They have to be marketplace plans. I think most people have heard that if you want a subsidy, you have to enroll in the marketplace. So let's say that Anthem is offering a plan in the marketplace and you decide you want to enroll in it, but you, for some reason, cannot get through healthcare.gov. You could actually work with Anthem directly to do that enrollment, but they have to, you know, they would have agents or you could have a broker and they can make this work. All the details aren't available yet. I have seen at least one situation where it's happened, but it's one of these things where you'll have to stay tuned for more details. The problem with direct enrollment is that you don't do all the comparison shopping if, you know, and people sometimes think, well, I have Anthem now, so, you know, I'll just stay with them. But in the marketplace, it's all different, you know, in terms of provider networks, et cetera. So it's really important for consumers to actually view the plans and compare them before making a decision. Next slide. So healthcare.gov now has some new features. Cuidado de Salud, which is the Spanish language healthcare.gov, is now available, and that's very new. Healthcare.gov now has a remove feature that allows consumers to remove an application that has gotten stuck. And a lot of that happened back in October. People went in and they set up accounts. They got partly through the application. They weren't able to complete it. Now they're going back in. It's working better. They want to finish up, but they're still stuck. They can simply push this remove button and start their application over. And in some cases, consumers have filed paper applications, especially in October when the website wasn't working well, and they've not received a response. Well, now they can call the federal call center. They can confirm with the call center that an eligibility determination is somewhere in the system. The call center will give them their ID, and then they can go into the website, healthcare.gov, create an account, and by using their ID, they can pull up the eligibility determination and select a plan. So these are two things that are helping navigators and certified application counselors help the consumer move through more quickly and help the consumer who is directly doing his own enrollment to move through more quickly and more effectively.
But what happens if you filed a paper application and there is no eligibility determination in the system?
Then you're going to basically be the people at the federal phone line looking in the system can tell you what's in, if there's anything that's in there, like your data. Is all your data in there, and can you just move on, or do you have to totally fill out the application again? They'll be able to tell you what you have to do. Okay, so helping others get enrolled. Well, one thing is to have a conversation with someone about whether they understand the benefits that they will get from health insurance. A lot of people don't understand what health insurance can bring, and it's important to start that conversation with people that you know who don't have coverage. You can guide them to a navigator or a certified application counselor by going to localhelp.healthcare.gov. You can also help them find an enrollment event by going to www.ohioforhealth.org. And there you have two ways of finding events. You can either go to the map, in which case you will see, you'll see the state of Ohio with different little pinpoints on it as to where there are events, and you click on them to see exactly the time and details. Or you go to the calendar, in which case you actually look at dates to see what's going on that date. Next slide. The federally qualified health centers have received funding from the Health Resources Services Administration to hire CACs and help people get enrolled. They supplied me yesterday with a list. You can go to their website and put in your zip code, and it will guide you that way. But if you'd like to just look at a long list, we have the list now on our website, or will at least shortly after this webinar is over. And you can find a qualified health center near you with the names of the people who have been hired as the CACs and their direct phone number, so you can set up appointments with them. And the Ohio Association of Community Health Centers has started a text campaign. So you simply text CHC, the number 4, and then HEALTH to the number 67076. And then they will send periodic messages and updates. So you might want to get folks that you're trying to encourage to get enrolled to send the text, and then they'll keep getting little reminder text messages that they should be taking action. Next slide. Okay, Melissa, I'll turn it over to you for the poll.
Yep, we got a quick poll, and the question is, have you done anything to help someone get enrolled in the marketplace? We have a couple selections. I'll enable the poll, and then you can select your answer. Either maybe you've referred someone to a navigator or to a certified application counselor. Maybe you've given them the federal phone number or website. Maybe you've sat down with somebody at the computer and helped them get on healthcare.gov. Or maybe you're still trying to figure things out yourself. You can click no, you haven't had an opportunity to. But we hope after you participate in this webinar that you'll feel empowered to help others get enrolled. It looks like majority of people are saying that you've referred people to the federal phone number or website. Great. I will share the results of this poll so you can see what people responded. And then we'll continue on.
Okay, so how is enrollment going in Ohio? Well, we just got the new numbers today. In October and November, enrollments are 5,672. That's up from 1,165 in the month of October. So, and remember, the website didn't really get fixed until November 30th, so I think we're going to see a huge jump from that in December. I asked some of the organizations that are doing work what they've done. I'm going to go quickly through this because we want to leave a little bit of time for questions. So Ohio Association of Food Banks has done a large number of outreach and enrollment events, served nearly 9,000 people, and they've reached 1.25 million through media and other communications. Next slide. The federally qualified health centers have reported 2,300 assists and 650 applications. That was as of the end of October. They don't have their November data in yet. And they're now running at about 10 per day per CAC, and most of them 2 to 4 application submissions each day since October. At UHCAN Ohio, we've met with 100 organizational representatives from faith and community organizations in Cleveland, Columbus, Toledo, and Cincinnati to engage their interest in working with their congregations or memberships to become enrolled. We're now we just today hit our 4th person that we assisted with enrollment, done outreach to 23 people, and have participated in 2 events, and we have 1 tonight. Next slide. Enrollment assistance is available by going to the toll-free number or healthcare.gov or localhelp.healthcare.gov, and you put in your zip code and it'll point out a certified application counselor or navigator near you, or you can call the 800 number for the Ohio Association of Food Banks. And I was very interested in, there also are some other assisters in Ohio, and these are federal contractors that basically HHS put some additional money into Ohio beyond the Navigator grant. And so there are 2 groups. One is called SRA International. The other is called Cognosante. They have certified application counselors at offices in Columbus, Cleveland, and Cincinnati. They take people by appointment. They also go to where people are, and they come out to events. So they've been very helpful. Go ahead, next slide. And just to give you an idea of the kinds of organizations that have taken on the role of certified application counselor, and I went through as much of local help as I could get through. Yesterday we have 3 libraries. We have community action agencies in about 8 or 9 counties. Next slide. You can see a number of faith and community-based organizations, particularly in the large cities, and then 2 recovery organizations in Columbus and Mount Vernon and Newark. Next slide. Legal services, I only saw 1, Legal Aid of Southwest Ohio, although as I said I didn't get through the whole list. And then there are other advocacy and partnership organizations such as UHCAN Ohio, Healthcare Action Now, and others that are doing this work. Next slide. The Ohio Association of Food Banks, which is the largest certified navigator in the state, has a partnership with all of the organizations that you see listed here. And so they are all available to do enrollment. Next slide. And you can stay informed in these issues. You can follow us on Facebook and Twitter. You can join our newsletter by signing up on our website. And Alyssa, I think we're at the end, aren't we? Questions?
Yep, we're going to take some time for questions here before the hour is up. Let me quickly look through some of the ones we've gotten so far. Okay. So after March 31st, will people still be able to enroll?
Do you want to take that, Kathy, or do you want me to?
No, I can do that. After March 31st, when open enrollment closes, you can't enroll again until open enrollment opens again, which is November 15th, unless you've had a change of circumstances. Let's say you lose your job and you lost your employer-based coverage. That's a change of circumstances. You'll be able to do a special enrollment. You know, any change in circumstances that causes you to be newly needing coverage will enable you to enroll. But otherwise, if you just didn't get around to it, you're going to have to wait till open enrollment. And you will, if you don't enroll by March 31st, pay a penalty at tax time for not having coverage. Kathleen, you want to add anything? Yeah.
The special enrollment periods do have a time limit. I can't say exactly what that time limit is, but I think it's like around 60 days, but don't count on that for sure. So
from the time you encountered this new circumstance.
Yes, right. So don't think that, you know, you can just do it any time. It's like there's a specific clock running after the event occurs.
Okay, we got another question, and it asks about the different levels of coverage, like the silver, bronze, gold plans. You mentioned how there are different plans within each of those levels.
Yeah.
Can you explain how those differ or what makes them different?
Well, first of all, on each level, the plan gets labeled with one of the medals based on the average percentage of your health care costs that it will pay. But then once you're on the silver, all the plans that are on the silver level, for instance, they all pay, if an actuary looks at how much the average person would pay, and that's a very, you know, it's sort of a rough estimate over a lot of theoretical people. They're all going to pay 70% of your costs if you use if you use a certain amount of health care. But they're all going to be different in terms of, like, some of them will have a $30 copay for a doctor's visit. Some of them will have a $10 copay. They'll have different deductibles. Some of them will cover 7 visits to a physical therapist. So you really have to look at the details of each plan, because they're going to cover different amounts of each essential health benefit, and the cost-sharing structure will be different in each plan.
And if I could just jump in and
Sure.
say that's why clicking on the summary of benefits is so important when you're either choosing a plan or helping someone to choose a plan.
Okay, we got another question.
And let me add one other thing. I haven't done this yet, and I confess it, but you can go on the website if you're curious. You can create an account, and you can shop for coverage and, you know, look at, you can do a lot of that. You can go online, and now, as Kathleen said, you can even look at the plans without setting up an account. And so if you're going to be talking to other people about the website and you want to understand this better, there's nothing like going on the website and pushing all the links. There's a huge amount of information available on the website.
Okay, another question we have is, if I don't pay a federal income tax, am I eligible for the tax credit?
Yes.
If your income's above 100%.
Yes. I guess yes. If your income is above 100% of the poverty level, you're eligible for a tax credit, even if you haven't, you know, I mean, maybe you're self-employed and it sort of comes out to the taxes owed, you know, gets really low because maybe you have losses and high expenses and all. But this is an advanced premium tax credit. It's not like the kind of tax credit where it's only if you owe a tax that, you know, that it offsets the tax you owe. This is different.
Right. And It's important to emphasize, though, that you're only eligible for a tax credit if your income is 100% of poverty or above. That's why the Medicaid expansion is so important, because without the Medicaid expansion, people with incomes below 100% will not get assistance in the marketplace, because the Affordable Care Act was written so that the Medicaid expansion would be there for people with lower incomes.
Okay, another question we have about prescription drugs is if you're able to get prescription drugs for very low prices, like $4 at Kroger's, without a marketplace plan, do you have to give up those medication savings if you choose a plan in the marketplace that lists the medication price for maybe $15?
No, excuse me. Pardon me. No, you don't have to give that up because that's between you and the store. Now, if
when you pay the $4 for the prescription, though, that $4 won't count toward your deductible because you're not buying it through the plan.
Right.
But you're free to buy stuff outside the plan if you can get it cheaper. The problem with, the only problem doing that is if you're trying to meet your deductible, those $4 purchases won't count towards your deductible.
And the same is true with out-of-network visits, and that wasn't something that we really had the time to cover here. But if you go out-of-network to see a doctor and you end up having to pay quite a large part of the bill because, the doctor is not bound to the reduced price that's been negotiated between the insurance company and its network, then that money you spend isn't going to count against your maximum out-of-pocket costs, and it's not going to count against your deductible.
But the person brings up a very important point. Just because you have this coverage doesn't mean you're going to get all of your coverage through your plan. If you've worked something out that's better for you outside, you're free to do that. And I think that's going to be true of a lot of people with $4 prescriptions.
I just said something that I'm not 100% sure of, so I'm going to just flag that before we. I know that the out-of-pocket or out-of-network will not count against your out-of-pocket max. Not 100% sure about the deductible, so that's. I will check on that and get you an answer.
Okay, we'll end with 2 more questions. Got a couple questions in about the HSA plans and how they work in the marketplace.
I'm not sure there are HSA plans in the marketplace. I guess I'm a little confused about the question.
Well, when we were comparing the screenshot of the CareSource plan, and then the second option was the...
Oh, bronze HSA?
Yeah.
Oh, okay. I don't know the answer to that question. I'm sorry.
Okay. All right, the last question is, where can we see about becoming a CAC or volunteering to help in Columbus to help get people signed up for coverage in the marketplace?
Ooh, well, that's easy. You can go to the UHCAN Ohio website, and maybe, Alyssa, you should say exactly how do they find the volunteer application?
It's under UHCANOhio.org/CACs, plural.
And so you can actually file an application online, and then we will, excuse me, reach out to you to ask you to come in. These are all volunteer positions, and help you move through the process of becoming a CAC. If an organization wants to become a CAC organization, then they should go to the CMS Marketplace site. It's easier just to Google apply certified application counselor, and it will take you to all of the links that you need to read about how to do it. It's quite simple to file an application.
And just so people understand, when we say CAC, a Certified Application Counselor, that term has 2 meanings. One is that an organization becomes a Certified Application Organization and then designates employees or volunteers to be certified application counselors, and those designated volunteers or employees go through training and become certified application counselors. But you can't just become a certified application counselor on your own. You have to do it under the certification of an organization. So there may be other organizations out there that are looking for volunteers to be certified application counselors. We don't know of any others in Frank. I don't know if you do, Kathleen, but
I'm not aware of others that are taking volunteers right now. There may be some.
And
but
we're doing it so that we can get more volunteers out there able to do enrollments in community-based settings or do them in our office. We have volunteers doing both. So if you're interested and want to talk this through, contact one of us or Nita Carter here, and we'll help you figure out, we'll help anyone figure out how they can best help people enroll.
All right, before we close things off here, any last words, comments, encouragement from you, Kathy or Kathleen?
Well, I have one thing to say, as our friend Carl Owens reminded us earlier today. Don't be discouraged by the low numbers of enrollment here. Massachusetts in its first month had 123 people enroll. It's not unusual for people to wait, and given the exaggerated publicity about the marketplace not working, I think a lot of people were waiting. We just have to get the message out that the marketplace is working, that help is available, and we'll get you through. So we're relying on everybody to spread that message because it is working, and people are finding insurance way cheaper than they've ever been able to get before.
Yeah, I'll just confirm what Kathy said about the low numbers, and thank you all for being part of this. We look forward to answering your questions in the future about anything that's come up here. You've got our phone number, so feel free to call us or email us.
Yeah,
right.
Thanks, everyone. Thank you, Alyssa.
Yeah, I just want to thank Kathy and Kathleen for taking time to present today, and for all of our participants who took time out of their day when there were plenty of other webinars to go to today, and to participate in this one. We will be sending a follow-up email with some additional information that will include the recording of this webinar as well as the PowerPoint. And as Kathleen said, if you ever have any questions, don't hesitate to contact any of us here. We do encourage you to check out our website. We are keeping it updated with up-to-date information at UHCANOhio.org. Also check us out on Facebook and Twitter. Thanks again for being here today. This concludes our webinar, and have a great afternoon.